Okay, thank you everyone very much for joining us today for this is what the second or third day of the Diapoint virtual family picnic. My name is Pam Durant. I am the founder and managing director of Diapoint. And as most of you know, we were going to do this face-to-face back in March before COVID came to town. And so now we've decided to do it virtually. And one of the doctors that we had that was going to participate with us in our Ask the Expert corner was Dr. Nandu Thalange, and he actually agreed to join us in March. And I'm so happy that he is here today to talk to us about diabetes in sports. Before I turn it over to him, I will read his bio because it's quite long and important because the work he's done is just amazing. He's a consultant pediatric endocrinologist at Al Jalila Children's Hospital and graduated from King's College in London in 1988, intent on a career in pediatric endocrinology. So we thank you for your intention. After junior posts at King's College Hospital and other hospitals around London, he moved to the Royal Manchester Children's Hospital to take up a research training post in pediatric endocrinology. His research at that time was focused primarily on the physiology of normal and abnormal growth accumulated in 3 significant papers in the Journal of Clinical Endocrinology and Metabolism, Pediatric Research, and the Archives of Diseases of Childhood. After completing his research post, Dr. Nandu moved to East Anglia, completing his training in Norwich and Cambridge, including a year in child public health. In 2002, Nandu took up a post as a consultant pediatric endocrinologist at the Norfolk and Norwich University Hospital in East Anglia until he left in April 2017. He ran a large pediatric endocrinology, diabetes, and weight management service, including specialist clinics for neurofibromatosis, let me see if I can get that right, achondroplasia, and bone disease, notably osteoporosis and osteogenesis imperfecta. The diabetes service had over 350 children and adolescents with diabetes, including 60% on insulin pumps, and achieved excellent results in the National Diabetes Audit. Dr. Nandu has been an investigator in a number of collaborative multi-center research studies in diabetes and endocrinology, including being chief investigator for the international multi-center trials that led to the approval of insulin to determine an insulin degludec. Insulin determer? Tell me the name.
Levemir is the trade name.
It's Lavamir, right? I know. I actually, when I read your bio first, I looked it up and I said, oh, this is Lavamir. But yeah, that's how it's marketed, right? In children worldwide. His other research interests include hypertension. He co-authored a paper on the normal ranges for the blood pressure in Great Britain, based on an analysis of over 20,000 children and young adults, physiological impacts of disease, epidemiology, and child public health, particularly avoidable child mortality. He is a public speaker and frequently presents to international audiences, and we are so happy that you are here and that you've dedicated your life to this research. And being a physician, I know from the community that you're always spoken so highly of, so thank you so much for joining us. We really appreciate you being here.
Thank you, and my honor to be with you this morning.
Thank you. And so to start things off, so Dr. Nandu has a presentation that he would like to share with us. So I'm going to share that with you right now. Let's see here, share screen, multiple. Why is this not working for me? There we go. Okay, there. Okay, so Dr. Nandu, I will turn it over to you. Just please let me know when you'd like me to change the slides.
Okay, so my remit today is to speak about exercise and diabetes, and I'm going to do that by talking to you about 3 different children in different circumstances and on different kinds of therapy for their diabetes, and I hope there's something in there for all of you. So without further ado, let's press on. here are my three cases, Oscar, Emily, and James. So we'll start with Oscar. So Oscar's had diabetes since the age of 3, and he's on insulin injections with Humalog and Lantus. He has a freestyle Libra, and the family is going to spend a day at the beach. But this could be a day at the theme park, it could be a number of other events, could be a day on an active holiday. So he starts off the day with a good high-carb breakfast because he's going to be really active. He doesn't need as much Humalog, so he has a reduction in his insulin dose for breakfast. Now, when you go to the beach, sand, sun cream and seawater will remove a lot of adhesive patches, so you need to cover a Libra or Dexcom or whatever with enough covering to make sure it stays on, because it's a bit of a disaster if it falls off, and even more of a pain putting it on when you've got the body covered in sun cream, sand and seawater. So best to be prepared. And Mom's taking lots of drinks and snacks to keep him topped up and in balance. She's put the Libra in a Ziploc bag, so like a freezer bag, because that's a very good way to keep it dry, because it's, again, another disaster if it falls into the rock pool. So at least be prepared. And his insulin and glucagon are always with him, of course, as they are with you. So Mom and Dad are checking his glucose frequently and keeping him topped up with water. Water is very important, actually, because dehydration leads to hyperglycemia. So it's very important, particularly on hot days with lots of exercise, to make sure you're getting enough hydration. And the moment his glucose starts to go low, as when he went below 90, then he gets a small carb snack and some sports drink, not because 90 is dangerous, but to avoid him dropping further, and you know how quickly that can happen. So they have a wonderful day at the beach, but on the way back home, Oscar has a hypo in the car, and the clue is that he falls asleep, which is unusual for him in the car. I know it's common for a lot of children to do that, especially after a tiring day at the beach, but Oscar is a bit of a hyperactive lad. But he quickly gets better with some glucose gel, and when he gets home, he has a big bowl of pasta to recharge his carbs. And that evening, before bedtime, he has a bowl of oatmeal, and Mom reduces his Lantus. And Dad gets to check him in the night to make sure his glucose is okay. I normally suggest checking around 2 to 3 hours after Oscar's bedtime, and then again around 2 to 3 a.m. So what are the main points with Oscar? I think being prepared pays off. You know, the more preparation you can do in advance to make sure the day goes smoothly, the better it will be. You need less insulin on active days, but also afterwards, and that's very important. Now, with Lantus, or indeed Levemir, you can reduce the insulin the night after exercise. If you're on Tresiba, it doesn't really work, because Tresiba has a life of essentially around 2 days. So if you're on Tresiba, you have to top up with more carbs at bedtime. Frequent glucose checks and small adjustments just keep him in balance, so water or sweetened drinks, depending on what he needs. And extra carbs before and after, well, helps top up the fuel tank anyway, if not quite fill it up. Excitement pushes up glucose, but as you will have discovered if you've ever done a correction when the glucose is high because of excitement or exercise, which sometimes pushes up glucose, then you notice that the glucose drops like a stone. So Mom's not correcting him as she normally would, unless she thinks he's insulin deficient. And even when you've done all that preparation, hypos still happen. So you just have to be prepared for it, and it's a normal part of life, and provided you manage it safely, there shouldn't be any alarms and excursions. So if we go to our next customer, so we have Emily. Now Emily is a serious, hardcore footballer. She's had diabetes for 4 years, and she's on an Accu-Check combo insulin pump, not perhaps the best pump, but it's accessible, perhaps more than the other pumps, at least in UAE, and the Dexcom G5 CGM. She also takes an injection of Tresiba at bedtime, and we can talk about that if that's of interest to you. So that injection of Tresiba replaces some of the basal insulin in her pump. She has a game later today, so she's having a high-carb breakfast, topping up beforehand, and then she has a small lunch 90 minutes before the game. It's not a good idea to have a meal and then immediately rush off and do competitive sport. You really need to leave an interval to allow the food to be absorbed, and I would recommend at least 30 minutes and preferably 60 to 90 minutes. Because when you start exercising with a full stomach, actually you slow down the absorption. So you're increasing your glucose requirement and reducing the absorption of glucose at the same time. So better to leave enough time. She checks her glucose 30 minutes before the game, aiming for a glucose of 140 to 200. Now this is a personal range, so different people will need different ranges, but in general, I think 140 is a sensible number if you're going to be doing a lot of exercise as a minimum. You know, the top end, 200, 220, 180, all of those are okay. It depends how easy it is for you to hit those numbers. Her glucose is only 120, so she has, in addition to the carbs she's having for the exercise, she has an additional small carb snack to get her into target, and lots of water to keep her hydrated. Well, I say lots of water, enough water to keep her hydrated. And then just before the kickoff, she checks the glucose again. It's 160, but the arrow is down, so she's going to have an extra sports drink to just lift it up. You don't want to be starting the exercise with the down arrow, because that will accelerate the decline in glucose. And she takes off her pump. She doesn't like to wear her pump when she's playing football. So Dad is on the touchline, keeping an eye on her, and he's got all her things with her. Now Emily's a forward, so she does a lot of running in the game. It obviously rather depends what position you're in as to the balance of exercise you do. So if you're the goalkeeper, you're perhaps not going to be quite so active and not quite so much in need of all of these measures to keep you in a good place. And from experience, Dad knows Emily needs around 30 grams of carbs for each half of the football match. And usually she has a Kit Kat and a sports drink before the game starts, and then she'll have a small snack and another swig from her sports drink at half time. Now look, Emily scores on the stroke of half time. She's a fantastic footballer. So Emily's hyped. It's half time now, but her glucose is very high, 242, but Dad knows this is excitement. He checks her blood glucose just to make sure that she's okay, and also can check her ketones if necessary. And he connects her pump to give her some insulin via the pump to make up for the basal insulin she missed out on. And she has her sports drink and some raisins. Raisins are a good way of giving you energy without filling you up, which is not a good thing when you're racing around a football field. Emily scores again in the second half, and they win 3-1. So a fantastic game for Emily. After the match is over, Dad reconnects the pump, but he's putting an 80% reduced basal rate for 8 hours. And that's not untypical. and then a 40% reduction for a further 8 hours overnight. So these are the sort of levels you may have to reduce your insulin by if you're a serious sportsman or woman. And so today is a good day because she gets pizza and ice cream for dinner, which will help replace the energy she's lost. But pizza has a lot of long-lasting carbs in it, as I'm sure you've noticed, those of you who have had pizza and seen the glucose stay up for ages. And she has some extra carbs at bedtime, just in case she drops overnight. And Mom is on night duty, which is as usual. So what are our lessons? Well, Emily has a good routine now, and she knows how to manage a game. She prefers not to wear her insulin pump during games. It's potentially going to fall off or break, so there are pumps that you could wear. If she had an Omnipod, she could wear that, but she prefers not to. Now for patients, or not patients, sorry, I'm saying the wrong thing here, sports people who take their pumps off for periods of time, then using some extra basal insulin by injection is a way of keeping you covered when you're off the pump. And this is particularly important if you have long periods when you're not wearing the pump. So for example, runners who don't want to wear their pump, or if you have an intensive training session all morning, football training, then that would be another time when you might need this solution. Now, one of the key things is that she's getting enough carbs. She's figured out that she needs around 60 grams of carbs for the whole game. That may sound an awful lot, but actually that's the kind of carb requirement you have if you're doing intensive sporting activity. At half time, she's having the carbs, but only in a small, compact way, so that in the form of raisins and sports drink. But she doesn't want to fill her stomach up and then run around on the football field. And then afterwards, as I already said, pizza and ice cream is perfect for keeping up her glucose afterwards. So, on to James. So incidentally, I didn't say, but all of these cases, so the pictures I stole from the internet, but all cases are real cases, just disguised. So anyway, here's James, and he's a bit of a reprobate, I'm afraid. So, but the thing he loves more than anything in his life is skateboarding. He got diabetes 3 years ago, and he's a bit hit and miss with his diabetes, unfortunately. Initially, he did really well, actually, on an insulin pump, but it became something that he focused on and came to dislike. He essentially hates diabetes, which I think is not an uncommon feeling in the teenage years, and disliked that physical reminder. For the same reason, he stopped wearing his Freestyle Libra, which was a shame because that's something that is a pretty innocuous thing to wear. He's on Lantus and Humalog, and he spends hours on his skateboard not eating or drinking much, and generally not thinking about diabetes at all. So part of his reasoning for the not eating and drinking is then he doesn't need to give Humalog. But unfortunately, if you're hyperglycemic and you exercise intensively, then you can drive yourself into ketoacidosis. And in fact, one of his 4 admissions with DKA followed exactly that scenario. He'd forgotten his Lantus the previous evening, so we had to move to Plan B. We need Plan B, and there are various Plan Bs we can come up with. This was the Plan B I came up with for him. So due to his recurrent DKA and unwillingness to carb count, we put him on a fixed combination insulin. Not a fan of these, but Rhizodeg is probably the best one. This is a combination of NovoRapid and Traceba. And on days when he's going skateboarding, he has a good breakfast of pancakes and reduces his Rhizodeg by a good 6 units before he goes out. Tresiba is fantastic for suppressing ketones, so it's why we chose this particular combination. He checks his blood glucose before leaving home, and if his ketones are over 250, and if blood glucose is over 250, he checks his ketones too. He takes water with him, but he won't take snacks. He doesn't want to carry a little bag or anything useful with him, so he has money for snacks, which isn't ideal, but sometimes it's the art of the possible. He has a big meal the evening after skateboarding to top himself up again. So it's not ideal, but not everyone is perfect. So I think we can say Emily is pretty perfect, but sometimes we need plan B. But the elements are the same. You need carbs beforehand, reduced insulin doses for exercise, and extra carbs afterwards. So the elements are there. So if we look at the basics for exercise, I'd say the key thing is be prepared, learn from experience, because everyone is different, everyone's exercise pattern is different, and you don't, there isn't a recipe that always works for all people in all situations, but the principles are what we've discussed. So don't be stingy with carbs for exercise. If you're a serious sportsman or woman, then you need 0.5 to 1 gram per kilo per hour for exercise. So that's a lot of carbs, and it's best taken as a mixture of food and drink. Not all as drink, because that would tend to lead to you needing to go to the bathroom, which is inconvenient in the middle of a sporting contest, and not all as food for the same reason. Actually, you can get diarrhea if you exercise intensively and then having eaten. So aim for a glucose, I say 140 to 200, but you know, it's individual. You may find different numbers work for you. And remember that high intensity, short duration exercise, and indeed excitement, as we saw with Emily, increases glucose. But it comes down on its own without insulin. That's just a temporary buzz from your adrenaline and cortisol and other stress hormones. Try not to eat too close to exercise, because you're denying yourself the goodness in that food, because it slows down the absorption if you exercise and the food is still in your guts. So 60 to 90 minutes is an ideal time interval to leave. I would say 90 minutes if you could do it. And pre and post carb loading will reduce your risk of hypos, not only today and tonight, but also in the next few days, because as I'm sure some of you will have experienced, when you have had a bad hypo, actually the hypos keep on coming. So it's good to top up your carbs. So that's the end, and I hope that was of interest. I thought presenting it as cases will make it more relatable, and I hope it's prompted some thoughts and questions in your mind. So,
that was incredibly informative, and I could relate to almost all of, I think, all of those at any given time as a parent of a child with type 1 diabetes. We live it all the time. One question, when you mentioned drinking sport drink throughout, and they tend to be high in carbs, and it can be good, but then the challenge I have personally with my child is he'll drink too much of it, I think, sometimes, and then that causes a spike. How much, if they're drinking sport drink, how much is enough and not too much to drink?
So that's why having something like a Kit Kat, which is obviously quite a lot of carbs, coupled with the sports drink beforehand, means you don't have to have so much of the drink ongoing. And obviously if the glucose is high at halftime, and not, if it's high due to insulin deficiency, then you'll be going to be drinking water rather than your sports drink, and you can have the top up with sports drink afterwards if you need it. So I think it doesn't have to be sports drink. It could be, you know, orange juice, but in my opinion sports drink is better because it usually has some electrolytes in it, and you need to stay hydrated. you know, if needs must, you can always have insulin, but it's not ideal to be giving insulin in this situation. So I think if at all possible, just try and keep the balance by adjusting water and sports drink intake. But be prepared to tolerate spikes in glucose from excitement and sport. That's normal. So,
Yeah, and I find it very challenging now because he's at the age where I'm not necessarily there all the time, and so he just wants to be normal. And I always say normal. He is normal. He just wants to not have diabetes like everyone else, and everyone's drinking sport drink freely, and he's not really thinking of it. So we do see some highs throughout the day. Another one on the food and carbohydrates, and I love that there's a situation where pizza will actually like help work. I never thought of that. And I do see the hypos after, and I can tell you he's on an insulin pump, and the things that we have to change on days or some periods where he's not exercising as much, it's drastic, the amount of insulin that you need and don't need. If you are, and of course, I'm sure it changes over age, but is there an optimal kind of number of carbs for the meals, like the meal you said to have 90 minutes before? Is there an ideal number of carbs? And then also for the carbs throughout the day for a young, active athlete to eat?
yes, so that's quite a difficult question. So, because most of us actually have quite a lot more carbs than in fact we need. So if you're inactive, habitually inactive like me, then you need only about 130 grams of carbs actually, and that's also true in children. So most children are having a lot more carbs than that. So in general, I don't find it necessary to specify an amount of carbs because this is a trial by ordeal. You have what you think is your normal meal. You make sure it's high carb, and then see how you get on, because that's you have to do this by experiment. Everyone is different, and the sports is different. So if you're going horse riding, that's very different to throwing the javelin. So you just have to go with the flow and see what works for you.
Yeah,
That's meal, but with a bit more carb bias.
yeah. One of the biggest challenges and frustrations of diabetes at the same time is, yeah, no two are ever alike, and even the person with diabetes can do the same thing on different days and get different results. It's absolutely fascinating. Let's say we have a question. Says, hello, doctor. My name is Emily and I play cricket. Hi, Emily. A challenge I have sometimes is that in spite of ensuring my sugar levels are above 200 before I start training, it tends to fall down pretty quickly. Since I start training at 6:30 a.m. in the morning. Wow, Emily, you're amazing. I eat only a banana. What would you recommend would be a good breakfast to eat that early to keep my blood sugar levels up or stable? I train for 2 hours in the morning.
Okay, so Emily, it seems that you definitely need more carbs, but that's difficult because obviously you can't realistically be getting up at 4 in the morning to have your breakfast. So I would suggest that you have a sports drink with you and take drinks from that. I presume you have a CGM or glucose monitor of some sort that you can easily check your glucose while you're doing your cricket. So I think cricket is a bit more friendly to having something by your side when you're actually playing, so you can discreetly take a swig between overs or something. But so I think you need more carbs. I think something like raisins is quite a good rescue therapy if you see you're dropping a bit too quickly. You can just get those nice little boxes of raisins if you like them, obviously. Or chocolate buttons if you don't, but they might melt, I guess, in the UAE. It's a perpetual hazard. Chocolate buttons was one of my children's favourites in the UK, but perhaps not quite so useful here. Maybe M&Ms would be a good one. And then you need some long-acting carbs. So if you can, then maybe have some muesli or oatmeal, if you can. I mean, I realise you don't want to be rushing out onto the cricket field with a full stomach, but something like that is going to keep you going a bit longer. And actually, a chocolate-based cereal is not terrible in that situation, because chocolate helps the cereal last a bit longer. And most cereals are pretty terrible, but you know, if cereal is practical for you, then you know, a chocolate cereal might be one that will keep going a bit longer. I suppose the counsel of perfection is, you know, bacon and eggs and slices of toast and getting up at 4 o'clock in the morning, but I don't think that's going to happen. So let's go with banana and some muesli or oatmeal as a practical solution.
Yeah, we actually at home, I started a couple years ago making our own granola with oats and nuts and whatever, and then it makes your house smell amazing when you bake it. But actually, I give that to my son in the morning before he's headed out to basketball, and they've been doing at a social distance kind of camp, but 4 hours of activity. And I can say that we've had really good results with that because it has kind of helped hold his blood sugar. So that was a really kind of good breakfast that was helpful. And then sometimes he uses almond milk for that, but sometimes he'll use rice milk, which has a lot of carbs in it too. So I really like those as kind of morning sport things. But Emily, well done for getting up and training at 6:30 a.m. I love that. You're awesome. Is there anyone else that has questions? Maybe there's some other kids on the call that are doing sports, and you have questions about it. Because I don't want to be asking all the questions. I have tons of questions, but I know you probably do too. Okay, Salma, who plays football, and usually my excitement brings down my sugar levels, so I have 2 slices of cheese fatayr, kind of like pizza, and my sugar levels go really high. When I play, it starts to go down, but it doesn't ever go below, or not ever, but it won't go below 200. So what do you suggest that I eat?
Well, I think you've discovered food that perhaps isn't working. So I guess it depends what is practical for you. Maybe just one of those, maybe one slice would be better, and of the cheese fatayr, and some other. I mean, like slices of apple are good. Quite coarse, slowly absorbed. And you only need perhaps half an apple, so you don't necessarily need to have a large amount of it. In fact, you don't want to have too much when you're just about to go out and play football. So I think it's about figuring out what works for you. So it sounds like the cheese. I mean, I think most Arabic breads are really high in carbs, so I think you're going to struggle if that's all you're having beforehand. The cheese is good; that will slow down the absorption of the carbs. So I think one of them might be good, and then something else like some fruit would be a good idea. I hope that helps. You can tell me afterwards.
Yeah, let us know how your results go, and we'll try that. So here's a question. Someone sent this to me directly. Their son has been recently diagnosed and didn't start any sports yet. I'm a little bit confused of the type of food and snack that should be given at such an age. He plays taekwondo, does gymnastics, swimming, and football.
So he's doing a lot of exercise, which is actually extremely good treatment for type 1 diabetes. So the more active you are with diabetes, the better your body likes it, and will lower your risk of complications in the long run. But it's all about keeping balance. So he's very active, so he's going to be needing quite a lot of carbs on those sporting days. So I think one of the commonest pitfalls, particularly when you've been newly diagnosed, is the thought that perhaps by reducing the carb intake, you don't have to do so many insulin shots. But actually that doesn't work then, because that means you just run out of steam. You're in your... So if we go back to my footballer, Emily, then actually when she started playing football after having had diabetes, she just found she couldn't keep going. She could play for half a game and then by half time she was no good. And that was simply because of lack of carbs. So the key thing is you have to have enough carbs and you have to be aiming for balance. And it is complicated and you have to sort of figure it out, and your endocrinologist should help you do that, or your diabetes educator, because that's a fantastic resource to help you. You know, we all of us have experience of our keen sportsmen and women who, so, you know, I was lucky, I guess, in the UK in that I had national standard athletes. You know, one of my customers was a swimmer at the Commonwealth Games, and another was a professional rugby player for Leicester Tigers, and so, you know, we have had lots of experience. But as Pam said, everyone is different, so we can't really generalize, but I'd say perhaps, particularly when you're newly diagnosed, the thing is to make sure you're having enough carbs for the exercise. So I gave a guideline. If you're being active, at least half a gram per kilogram per hour. So let's say you've got a child of 40 kilos, that means you need at least 20 grams of carbohydrate per hour of exercise. So if you're doing 2 hours worth, that's 40 grams. It should be spread out over the 2 hours, a little bit before, maybe some halfway through and at the end, and then the other adjustments with carb-rich meals before and after, and adjusting the insulin, because you're obviously burning off a lot of that energy. With the exercise, you don't need insulin to reduce your glucose as much as you normally do. So we have, you know, we have certain advice that we give for exercise about how much to reduce the insulin. And so I would suggest talking to your team about that.
Great, thank you. And that formula that you mentioned, I'm sure that there's a lot of people on this call that would love to understand that. So if after the call, whenever you're free, not during your vacation, after your holiday, if you could send me that and I'll share it to those that attended this call. Because I think that is something that we're always questioning, wondering, do they get enough? We know they need energy. We want them to have good results. And while we know not even sometimes those formulas are super accurate, but just to use as a guideline, it can be helpful.
Good job. So Emily actually was about 40 kilos at the time I presented her, as it were. And so 30 grams so she was actually having 60 grams over an hour, so 1.5 grams per kilo.
1.5 gram per kilo.
She was having a lot, but that's what she needed. You know, she was incredibly athletic, you know, running the length of the football field throughout. So she just needed that extra. So even 1 gram per kilo per hour may not be enough.
Great. Okay, that's great. No, she sounds like a superstar. I love that case, actually. She's a rock star. I have another question that came in. Where was it? Let me make sure that I didn't miss. Why do doctors recommend that if our blood sugar is high, we should not participate in sport at that time?
So it all depends actually why your glucose is high. But if your glucose is high because you don't have enough insulin on board, and then you exercise, you can drive yourself into ketoacidosis, which is what James did. Now, in fact, what James repeatedly did, because he was a dummy. But anyway, so if your high glucose is due to stress or excitement and you have insulin on board, then actually you're safe and it won't happen that you will push yourself into ketoacidosis. But it does make sense if your glucose is high to check your ketones, because if ketones are there, it means you haven't got enough insulin on board. The only way you can make ketones is if there's not enough insulin. So if you don't know, check the ketones and then you'll know. Stress hormones that I was talking about that make you, that you make when you're excited or when you've just done 100 meters, they push up the glucose, and the ketones will go with it. unless you have enough insulin on board. It's one of the reasons I love Tresiba, because it basically switches off ketogenesis. So it's very, very hard to get ketones if you're on Tresiba.
Oh, very interesting. Okay. Next question. Hi, I'm Sophia. Thank you for the question, Sophia. I do cross country and athletics. After a long run or even midway through, I tend to get a headache. This only happens during these runs and not every day. My parents and I thought it might have been because my levels might be high, but on most occasions, my levels are at a range of 120 to 180. Do you possibly know what might be the reason for these headaches?
Well, it's difficult to say, but the commonest thing I would say is dehydration. It's not having enough fluid on board. We have a body composition analyzer here, and so whenever we measure someone's body composition, I don't know I've seen a single child in UAE who has a desirable water balance, which is 65 to 75%. I'm often seeing 50%, 52%. So it's very common in such a hot climate to just be a bit lacking in fluid, and that's a pretty potent cause of headaches. Perhaps making sure you've got water on the go, as it were. It sounds like your glucose is amazing, actually, so that's very impressive. You're doing a good job with that. So the obvious thing, I think, would be water to keep yourself topped up with fluid. That's the most likely, I think. Obviously, it's hard to say without knowing the exact situation.
And the next question, can someone take insulin for a correction if you're high before sports, or would that be dangerous?
No, it's not dangerous. You just need to give less than you normally would. So depending on the activity levels, it would be fairly typical to perhaps give only half your normal correction. So let's say that Emily had been about to do the game and her glucose was 260 beforehand, then that's too high. So she would have a correction, but maybe she would normally need, I don't know, let's say 3 units, but she would just give 1.5 units. I mean, she's on a pump, isn't she? So around 1.5 units. So half the normal correction.
Okay, don't worry. No problem.
Sorry, I lost my train of thought.
That's okay. We were talking about Emily's case and then how to give a correction if the blood sugar is high, and then she was only giving kind of half a dose. She's on a pump.
Always give more insulin, but you can't suck it out once you've injected it or infused it. So my recommendation would be to give a small dose of correction, which coupled with the exercise should bring your glucose down nicely. I think 50% reduction is reasonable. If you're incredibly active, or it's going to be a very prolonged period of exercise, then maybe even an 80% reduction. But you do need enough insulin in there to get the glucose into muscle, because that's insulin's key role in exercise is actually to help the glucose get into the muscle where it's needed. So if you don't have enough insulin on board, then you can't actually make use of the glucose.
And because I think we do have a few people on the call, they may not be using some kind of continuous glucose monitoring device. If you don't use a CGM or Libre or something else, how often would you recommend to be checking blood glucose?
I remember the first, when I started off in 1988, we had the Reflux S blood glucose meter, which was hideous. You had to sort of use a cigar cutter to chop off the end of your finger, bleed a pint onto the strip with a pillow of cotton wool, and then read the color change after 45 minutes through your agonized, teary eyes, and you would see your glucose 4 to 7. Okay. So it's, it's challenging when you're on blood glucose monitoring, but blood glucose monitors are better nowadays. So the short answer is as often as is reasonable for you to check. So I would check, as Emily did, half an hour before, just before, at any intervals that you have so if it's a soccer game, then you can check at half time. And obviously, if you're feeling unwell, then you have your diabetes go bag at the side of the pitch. You just quickly run off, check your glucose. I know that's not so easy. So I think it's unfortunately CGM is not available universally. But even if you don't have it all the time, it's really good for sport. So I don't think there is a good answer to the question, but the answer is as often as you reasonably can, and use that information to manage yourself. And obviously, you have to understand how you're feeling as well. If you feel low, that may be a sign that your blood glucose is dropping quickly, which you can't otherwise tell from a single blood glucose check. So, so frequently checking. Ideally, I would say, every half an hour to 60 minutes, you need to be doing a check. But it's what's manageable.
Okay. Yeah. And I know a lot of people, sometimes they tell me, like, if they're spending a day at the pool or the beach or something, like, being in the water and then having to come out and check. I think that answer is super important for those kind of circumstances, because it's very hard. Nobody wants to miss out on a game or having fun with your friends and stuff. But if you take the breaks and check, then you'll be able to spend more time in the long run doing the things, right? So here's a question. It's not sport related. Tiana's asking, she was recently diagnosed 3 months ago, and she's having some hair fall from the past week, and it's a lot. Would you be able to recommend how to stop it, or is that diabetes?
There's a normal balance in hair growth. So you have new hair growing, which is called anagen, and old hair falling out, which is called telogen. And when you've had a period of being very ill, then that tends to accelerate hair loss, but it's only temporary. We call it telogen effluvium. It's got a grand name. Doctors like to give complicated names to things. And it typically happens around 8 to 12 weeks after a significant illness. So in this case, it would have been the diagnosis of diabetes. So all the stress, I don't know how unwell you were at diagnosis, but that's also a contributor. But stress is a pretty potent cause in its own right. And it's temporary. So the new hairs are still coming. They will replace the hair that you're losing, but just for a little while, you'll be worried that you're getting a bit too thin. But it should all get back to how it should be, and your hair will be beautiful again.
Great, thank you for answering that. Does anyone else have any other questions? We have a few minutes left before we have to let Dr. Nandu get back to work, and I want to make sure everyone's had all their questions asked. Because I think through the cases, you've probably, like we talked before, answered a lot of the questions that we wonder about. What's a good number to start with? What are, good carbs? How can we avoid high blood sugars, low blood sugars? Being hydrated and taking insulin, and all of those things are so super important. And I think just for each individual, finding the balance is extremely important.
One of the, if you're into the sort of weird science that I like, then back in about 1996, there was a paper on diabetes in Diabetic Medicine, which is one of the big journals of the diabetes world, and it showed that diabetes is an inherently chaotic system. So you'd be glad to know you're all dealing with chaos all the time, every day. So you have my sympathy.
I agree with that. It is chaos, always. And we're trying to all find order in a chaotic world, and just throw diabetes in that. And I always call it kind of the Zen, and I hate to use the word disease, Zen condition, because you have to just be in the moment with it. I can't worry about what the number was before. I can't think too much ahead. I can try to achieve the number I want to, but I can't worry about too much of that either. You just have to kind of be there with it. So I'm achieving some kind of monk-like status and trying to manage it because I mean, all of the moms, I think we all share this similar discussions. Someone's asking the question that their son, 12, was diagnosed 2 months ago. His BSL increases after 2 hours of a meal. Why does that happen?
So it's just the normal process of digestion. So your glucose will rise after you've eaten. And now before a meal, we're aiming for glucose usually less than 130 to 140. But after a meal, we push up the limit a little bit. And in an ideal world, in the perfect world, which no one can achieve, we want the glucose not to go up above 160. So we still allow a little bit of a rise after meals. And it's simply the normal process. Unfortunately, if you're on injections, it's really impossible to completely exactly match the peak of the insulin injection and the peak of the absorption of the food, because that's affected by so many factors, like how much fat and protein you're having with your carbs as well. So in the US and Europe, there are super fast insulin analogues. So Fiasp is one, and there's a new one from Eli Lilly that I can't remember the name of. And they may be better for this type of situation because they get in quicker. So basically, when you're eating, it's a game of cops and robbers. You want the cops to head off the robbers at the pass. So you want to get the insulin in quickly. So often we'll advise, if practical, to inject the insulin 10 to 15 minutes before eating if you're on NovoRapid or Humalog. It's not always possible for everyone, but if you can, that's the ideal. Give the insulin a head start, cut off that glucose at the pass. And that will help get the peak level of glucose down. There is a three-step program that I sometimes will recommend to my patients. Depends how much of a zealot you want to be, so maybe not for everybody, but if you look at your glucose levels 1 hour after eating, if they are high then, that means you need to inject earlier. When you've sorted that out, if they are you then look at 2 hours, and if the glucose is high at 2 hours, even though you're now injecting at the right time, then it means your carb ratio is wrong and you need more insulin for carbs. And then when you fix that, if you're then high at 3 hours, then this is to do with potentially either the protein and fat content of your meal, and some people do this thing called protein and fat counting, which is quite complicated. So if you want to know about that, speak to your dietitian. But an alternative explanation is also the glycemic index of the food you're eating. So some carbs, like table sugar, is instant, whereas other carbs, like cornstarch, is incredibly slow. So that's another factor that you can look at. But in general, if you can get your timing right and you're on the right insulin carb ratio, then you can normally get a good 2 hour glucose, but it takes time and effort to achieve it. And I think you're doing pretty well if you're thinking about this question just two months after diagnosis. So I hope things are going well for you.
Great. And I think the last and final question, it's an excellent question I just received. Do all sports have the same effect on blood glucose, or would some increase it and others drop it?
So if you're running the 100 meters, your glucose will go up. If you're running the 2,000 or 1,500 meters, I guess it will be, then your glucose will go down. So, when you run, so very intense, short duration, we call it anaerobic exercise, pushes your glucose up. Whereas intense, long duration exercise, which obviously is not at the same level of intensity, you can't run at 100 meter speed for 1,500 meters, that will bring your glucose down. So that's the main way to think about it. And if you're doing karate, for example, then maybe That's going to be more of the episodic, intense bursts of exercise rather than the sustained long duration exercise. It doesn't matter that your glucose goes up, you've still spent the energy, it's just, you know, your body will collect later. So the glucose will come down, you just need to stay hydrated, take that fluid that I've said is important, and the glucose will normally just come down within 30 minutes. If you see that it's not coming down, then you may need some insulin.
Great, thank you so much. And we are almost finished with our hour, so I want to be mindful of the time because I think Dr. Nandu has patients waiting and everyone's probably got things to do throughout their day. But I want to thank everyone for joining. Thank you for all the wonderful questions, especially for you young athletes. You're superstars to be doing this with diabetes and managing it all. It's really fantastic. Your questions were great. And I just want to remind everyone that everyone that's registered, at the end of all the sessions, we will be sending you a discount for the Diapoint shop. So if you need anything, and Dr. Nandu actually mentioned tape for swimming in the beach, and the tape that we sell, the Stay Put medical tape, I don't have any here at my desk to show you. I'm in love with this tape. I didn't think it would be possible to love a medical tape so much, but it actually does what it says. It stays put. The guy that created it, he actually used to work for Dexcom, and he lives in Florida, which is a very similar climate to here. It's hot, it's humid, and he was always seeing, you know, people that weren't able to keep devices on because of the weather and all the humidity and swimming. So we found that it works really good for us. So that's just one of the many things that we have. Also, one lucky winner, we were talking about snacks and what to eat for sports. And one lucky winner is going to win a case of my newest product. And Dr. Nandu, I will send you some samples of these. This is called Pro Youth Nutrition. It was actually developed by a mom in the UK. And because her children were quite active and after football practice and things, she was noticing that, you know, that everyone was just kind of eating junk food all the time. And she wanted to do something about that. So she left her corporate job. I think she was in finance banking. And she started to focus on this. And she put so much research into her efforts to make sure that the quality is high product. It consists of dates, nuts, mostly cashews. So if you have nut allergy, it might not work for you. And whey protein are the primary ingredients. There's 3 flavors, banana, chocolate, vanilla. They're absolutely delicious. And I've had really good luck with these for my son's blood glucose when he's doing sports. And while I don't wear a CGM, I've had them myself before I do sports, and I feel really, you know, like I have good energy with them. So one lucky person is going to get a whole case of those. And also when you're shopping in the Diapoint shop, we'll throw in a sample in your bag so you can taste them as well. And Dr. Nandu, I'll make sure you get some. Thank you again so much for joining us. It was really so special that you could share your experience with us today. And I hope you have a wonderful holiday as well. And I look forward to seeing everyone again. Thank you.
Thank you very much for inviting me. Thank you for all being here. Fantastic to see you or to hear your questions. I can see some pictures. So bye-bye.
Great. Thank you, everyone. Have a wonderful day. See you next week at the next session where Sarah, Ademi, and I, the first session next week, will be talking about diabetes back to school. Take care.